we good to go? Okay, ladies and gentlemen, good evening. We'll make a start. And good evening to everybody in the room, and also to the audience watching and listening to us online as well. My name's Simon Oldroyd. I'm the PVC Dean of the Faculty of Health and Life Sciences here at DMU. Housekeeping first. We're not expecting any fire alarms, so should it sound, you should make your way to the exit and follow the event staff. For a small lecture theatre, I've just noticed there are 4 doors actually. There's quite a lot of doors for a small lecture theatre, but out of these doors on the far wall. So, welcome to this, the third in our leadership series of talks, and we started the series hearing from Sir Peter Soulsby, the Mayor of Leicester, and then we heard from Professor Ivan Brown, Director of Public Health in Leicester, and it was genuinely compelling, really compelling to hear them both talk through the past couple of years, and we all know what's happened over the past couple of years, and particularly how they handled that and how they handled the pressure of leading Leicester through the pandemic. But tonight's guest, Angela, was on the front line of what was happening in the National Health Service, and on that front line from, as we know, from March 2020 onwards. So, just by way of a little bit of introduction to Angela, Angela actually is an alumna of the university, so she's one of ours. She gained a BSc in Speech and Language Therapy before going on to a Master's at the University of Birmingham. And she began her healthcare career in Speech and Language Therapy, and then served on the National Management Board of the Royal College of Speech and Language Therapists. Now, as Joint Chief Executive of not one but 2 NHS Trusts, Northampton Healthcare NHS Foundation Trust and Leicestershire Partnership Trust, Angela has always prioritised her staff's well-being as part of her leadership style, and I think we'll hear some more about that a bit later when we start to have the conversation. This emphasis on employee well-being and communication through stakeholders has been widely praised, and Angela has recently been included in the Health Service Journal's top 80 most influential leaders in the English NHS, and in 2022 named as one of its top 6 NHS Chief Executive Officers. So, as we know, as I hope we all know and we're aware, the coronavirus pandemic has been the largest public health crisis in the UK since the inception of the NHS in 1948. NHS staff have been put under extreme physical and mental pressure, while our hospitals had to adapt quickly to ensure the safety of patients and the safety of staff was maintained. Angela's trusts provide 2 specific services that have been greatly affected by the ongoing pandemic: mental health and community healthcare services. And the challenges posed by the pandemic require innovative solutions. So Angela and her team have utilised new technologies to ensure her vital services can still run as efficiently as possible. And again, we'll hear a little bit more about that as we progress. As well as being a large NHS trust locally, Leicestershire Partnership Trust, LPT, is also a really important partner to us here at DMU. It's really important in the education and training of student nurses, particularly mental health and learning disability nursing students, but also speech and language therapy students. And we also, here at DMU, have a long-established research partnership with LPT, and particularly in the field of mental health research. And finally, Angela has also recently been appointed as a Pro-Chancellor of the university last year. So, what's it been like leading healthcare through unprecedented times? That's what we're here to find out tonight from Angela. So first of all, everybody, could I ask you to please welcome Angela Hillery. First of all, we're going to talk about leading through a pandemic. And I guess the first thing we need to say when we talk about that is that it's not over yet, is it? It's not finished. It's far from over. Things are different, but we're still in the middle of that.
Yes.
So we kind of need to acknowledge that, I guess,
Yes.
that we're not talking about a time that's gone. We're talking about a time that we're still very much in. Before we do that, before we get into talking about leading during a pandemic, I guess the first thing to say is welcome back.
Yes,
to
it's
DMU.
good to be back. It's
welcome
good to
back
be
as
back.
an
Yeah,
alumna,
it is, yeah.
as a graduate of DMU, and we were reminiscing, or you were reminiscing earlier about being a student.
Very
not,
much.
Not here, and certainly not in this building, but at Scraptoft.
No, Scraptoft, for those of you, was another campus that in those days speech language therapy students were at, and got very fond memories of it, I have to say. And I was talking about being a student with no mobile phone, because it just didn't exist. My children can't believe that. They just, I think, look at me amazed. But yes, it was a great place to be. I loved the speech language therapy course. I have to say it was a very intense course. So whether it is now, I don't know, but it certainly was then. And Scraptoft was a great campus. And as I say, very fond memories of being a student here. And you know, it certainly took me to where I am now, for sure. And I think as a clinician in the NHS, whatever role you go on to be, you never lose that, well, those core competencies, I think. And I certainly feel that I draw on being a speech language therapist nearly every day, actually, in terms of that, whether it's active listening or that communication. So it's good to be back. So thank you for asking me to come today.
Great to have you back. So, shall we dive straight into the period that we've been talking about then, from March 2020 onwards? So for you to tell us about how it was during that period, we talked a little bit about the challenges during that period. Yeah. What were the challenges for you as a chief executive?
Yes, I mean, I think that, I mean, you started with it, Simon, saying that it's really important to understand it in phases, because, as you rightly say, we're still in it. But I think my memory's looking back, and some of it is still blurred, because it's still, you know, it happened over a 2-year period, and you're acting very quickly, so you remember things periodically. But in essence, I think the real significant memory for me is the sort of uncertainty that was there. And I think that's the golden thread all the way through, was that it was a level of uncertainty that I've certainly never experienced before. And, you know, I've done 34 years in the NHS, and I don't think anything can prepare you for it. But the uncertainty was significant every single day, within the day and within the hour. So that was very important to convey. I think the other thing that was challenging in that period is, of course, when the NHS experiences anything as significant as that, it has to go into an emergency planning mode. Now, what that means is that it's controlled on a level basis, and of course one of the highest levels is the level 4 situation. We're under an unprecedented challenge. We've got to operationalise together, and we have to work together, and it becomes very command and control. And it's important to say we're still in a level 4 instant, actually, so emergency planning is still a feature that we have. But in essence, that means that our regulators operate that command and control. We then similarly do within the organisations. So both organisations had to set up what we call an incident coordination centre, which meant that everything had to be through one port of call in the trust, all the communications, all the requests for information, and that became the sort of hub, if you like, to send out information to every service and to our staff. So that command and control was very challenging. With that comes an awful amount of data requests, information requests, relentlessly, because of course everybody's trying to understand it. So they need situation reports, they need to understand how many people, what's going on, what staff are being redeployed, what staff have we got, what are we doing in terms of infection prevention control. You know, it could go on all the time, and that was over 7 days a week. So you had those sorts of emergency planning entities, and of course we've always had them, but never anything that existed over that period of time. So it was, I think initially probably people expected it to be over quicker, and you had a hope that it would be, but this went on, as you know, for a long, long period. So those sorts of challenges existed. And of course the challenge of being able to reach staff, because again Leicestershire obviously went into lockdown. That was challenging. So we had, you know, pre-vaccination. We didn't have the vaccination, which thankfully we did get in due course. But prior to that, I can remember thinking about the challenges of that, and we were very fearful of not introducing the virus into any environment, keeping our staff safe. And the challenge of keeping people safe was something that will always stay with me.
Yeah, I think we've kind of forgotten the pre-vaccine days a little bit, haven't we? And particularly, as you said, what the fear, how the fear permeated then.
Definitely.
At that early stage of the pandemic, we were seeing news reports, weren't we, from northern Italy and places like that in the very early first couple of months, that there must have been a palpable fear amongst staff.
Definitely, and it goes back to the uncertainty, but I certainly personally felt fear, and I knew I was responsible for over both trusts, in the order of 12,000 staff, and suddenly, whilst we believe and certainly endorse everyone's a leader in both organisations, I felt much more responsibility for staff than I've ever felt, and that was the fear factor of what if we haven't took the right decision? How do we know that somebody's going to be protected? And without having a vaccination, of course, there was people being affected in their home lives, and whether it was the media or people coming in talking about their own loved ones or their families or people that they couldn't go and see, etc. There was so much of that fear, and we were just very grateful when the vaccination came, of course, because we could start to see that it was having an effect. It was a safe option, and we clearly encouraged people to have that as soon as we possibly could.
And in the middle of all that, you as a chief executive then are making decisions. And again, there's that relentless decision making, presumably.
Yes, I mean, I think, again, just to give you a sense of it, so obviously as a chief executive you are accountable all the time, every day, any day, and that's the job, so that's not different. But within that, you're not being called all the time, or you're not being on fully, because no job does that. But this was different. This was 7 days a week. We operated what we call a strategic goal across both organisations, so that I could keep that overview and consistency, and equally help each other in terms of what could be done, what we were learning, because one trust would be learning this, and so we could actually accelerate it across to another, etc. So I did a strategic goal every day, and that was 7 days a week, every day. And of course that became the focus for what's come in today, what are the decisions, what do we need to take, what do we think we need to do, what we've been asked to do, what we're worried about, what are our risks, etc. And we did it, and that wasn't just me, that's lots of people involved in that. It's not at all just me, it's about the organisations working, and of course that was supported by everybody in all of the organisations doing their role, making a difference, but relentless. That's the word, I think it sums it up.
We were working throughout this and making decisions as well, but were you, in your role, were you acutely aware that the decision making ultimately was about lives, or a life or lives?
Yes, and again, one of the things that changed and still changes through the pandemic is the infection prevention and control guidance. It was, again, constantly changing as they learnt more, and as we learnt more, national guidance evolved to understand how we could respond to the virus. So that was very much a feature that we needed to obviously be acting on very quickly. But yes, the sort of palpable feel of people were dying. That was the reality. It wasn't something people were going to get unwell. People were dying, and of course, we were as much exposed to the media as anybody. But clearly, we were at the heart of it in terms of our hospitals, and we were involved in supporting our acute hospitals in terms of surge planning, how we're going to manage to get people critical care beds where needed. If we haven't got those, what are we going to do? It became a very stark reality that this was about saving lives.
So what was playing on your mind at that time then? What kind of things were you thinking, when you went home at night, you were thinking about in preparation for the next day? What were the things that were playing?
Yeah, I mean, I think lots of things, and I think it was fair to say that on a personal level I was worried for my family as well, and so obviously you're getting on doing the job, but I was very worried for my own family. My daughter was a type 1 diabetic. I was worried that, again, being in a work environment, what affects, etc., but also not wanting to expose them to perhaps some of the information I knew and the fear, etc. So that was definitely there as well. But predominantly it was staff. I was just worried about staff so much because, you know, people's stories were coming through, people were reaching out, people describing what they were dealing with either at home or work, and you didn't always have the answers. And, you know, you often can be in a case where you don't have the answers, but you can say, well, actually, this is what we'll try. You didn't necessarily know what was to try. So staff and their worries was something that was constantly on my mind. And how do we keep staff hopeful in a context of we didn't know what would happen next? Because I understand that, you know, we all have to have hope, and we all need to understand that there's going to be an end point and we're going to manage this. And I think we had to keep hold of the fact that if we work together, we will understand it together differently, and that gave us some hope. But it was hard, there's no doubt about it. But I relied totally on the staff, they were phenomenal. And, you know, I give credit to all of them. And, you know, I've got one individual in the audience who occupies my office now, because actually we had to prioritise where people are going to be. You know, and your role, supporting our volunteers, is critical. So, you know, making sure we could get people the right space they needed, etc., all those sorts of things.
And as somebody who normally gets out and about and sees staff and sees patients and interacts with patients, presumably, you couldn't do that? No,
that was the hard piece, because, you know, it's important to be visible, it's important to be connected. As I said, the lockdown here was particularly problematic, and I was generally worried about being responsible for introducing the virus, etc., and we all had to be very careful about essential work. But we had to find new ways. So, you know, I think I did a video every week, you know, people just to say how it was, just to connect, to make sure if people wanted to look at that, they could. If they didn't want to, we did newsletters. They were daily for a significant length of time. Our comms team were fantastic, you know, in both trusts. And again, they worked together to make sure that we could expedite the messages, but different ways, and then just making sure that through our virtual means, and we used a lot of connectivity through that, we still do, that we could connect with people. So whilst we weren't in the room, that sense of we're still together was so important, and to introduce times where we weren't just in meetings, but we were having, you know, whether it was a coffee catch-up or something around wellbeing in particular, so that people could have that moment to say it's okay to not be okay and to come on the screen and talk about it. So lots of different ways that we did.
That was really important. You mentioned a minute ago, Angela, around liaising with the acute trusts, acute hospitals,
yes.
And just wanted to ask you a little bit about that, because LPT as a trust or the Northamptonshire Trust doesn't exist in isolation, does it? That you have to work within what we call the system.
Definitely.
With other acute trusts, with social care and so on. So how did that go? How you know, was that easy? Was it difficult? Was it frustrating? What was that like?
Well, yes, we certainly did that, and everything we did, I think, was in a partnership context, because, as you said, Simon, nothing was in isolation and couldn't be. Whilst we had to take actions internally, they were to support people, and people were supported by all partners. So that meant that through the emergency planning framework, we had formal meetings. So again, as well as our internal trust meetings, which were happening, as I've described, we had system formal meetings, which would then, again, regularly meeting. You know, it might have been daily, might have been 3 times a week. It varied depending on the nature of it. But all partners coming together to understand what's the risk for our system at this time, what's the nature of the virus, what's our transmissions rates, what do we need to do, what are our hospital capacity looking like, how do we model for the future, because we've got some guidance nationally, but what do we think locally. Ivan in particular was, you know, instrumental, and other colleagues in public health, in terms of giving us that sense of let's predict and anticipate what we could do, what could make a difference. So all of that was in a planning context of together. But at the same time, the uncertainty that existed in the organisation existed in the system as well. So we took collective decision making.
And did you have direct contact with the Department of Health and Social Care at that
Yes,
time
indeed,
as well?
indeed. And I think that all those channels are open, and they remain open because we've still got, that sort of single point of contact where we can receive and obviously impart information as well. So, yes, it's an open road really, and but we were very reliant on local colleagues who are fabulous.
Yeah. So things have changed a lot. We've agreed on that, and I think you touched on this a little bit earlier. But you must do things differently now. The trust must do things differently. The system certainly does things differently. So what are those things? How do you do things differently now?
We do, and I think one of the things that's significantly different is that we have many people now who work predominantly from home, actually, and that changed massively through the pandemic. And as I said, I don't think we'd have ever thought that was possible, actually. And I do question now why we didn't think that those sort of things were possible, but they do. So what we did was we didn't assume that would be the case, but we did a series of what we call big conversations with our staff, where we talked about how things were, what was working, what didn't work, what they would like to retain, what they could work effectively in. So virtual working is a strong feature now, and one that we expect to continue with. Having said that, we don't want to continue with it and not connect. So it's a blended model that we're working towards. So certainly virtual working. We introduced that for treatment options as well, and again, what's important in that is that many of our clinicians got very creative about how they could still meet people's needs. Again, we've learnt from that. It's important to evaluate outcomes, but also to respond to some patients and public who really welcomed, different ways of working with us, but equally those that still need that face-to-face. So those things are different. And I think we also have a much stronger emphasis now on wellbeing and how we're supporting staff than we've ever had. And it's always been important to me, don't get me wrong, but I think it's the fundamental now part of everything we're thinking about is what's that going to do, how we're affecting staff, what do we need to do differently, could we think about how we're supporting in any which way. And that was significant, and one of the things that we certainly introduced on behalf of the system in both Northamptonshire and Leicestershire, both trusts took the lead on this, was we introduced health and wellbeing hubs for health and care staff. And that was a demonstrable way of supporting staff with different levels of support, whether it was general wellbeing advice, etc., right through to trauma support and psychological
What did those hubs look like then?
Well, they are again a collection of staff that come together to offer a range, as I've described, and we obtain some resources for those. And what we do is we have referrals, as you would a treatment service, into that hub, and then we can sort of triage people into a level of service, and that's across all the staffing across the health and care sector. And that's been amazing that we mobilised that very quickly.
Yeah, fantastic. When we were talking earlier, you said something that really struck me. Well, we're talking about staff, I guess, that you said everybody from this pandemic has got a story, everybody, and that's really important to remember as a golden thread.
Yes, and I think that comes back to the focus on staff, because one of the things that I think will always stay with us now is the need for compassion and compassion and kindness, because everybody across the whole organisations needed to work differently, needed to adapt, was dealing with very difficult situations in their work or at home. And again, something that I would often say in connections with staff is, remember, everybody has a story and you may not know it. And some people would be upfront about what was happening, others wouldn't be. And I might know something about what was happening in somebody's lives, but actually not everybody would know. So that creating that sort of compassion thread that said, remember, there is a story there, we've all got one. And if we can be kind and compassionate to each other, then obviously that will make a big difference. So that stayed with us, and I'm hopeful that becomes something that we take from the pandemic to strengthen even more. the compassion focus, because it makes a big difference.
And how did you handle that then as an individual? Because you must have, in order to function, you must have had to go home, try and switch off,
Yes.
switch back on again the next day. How do you handle that shift between states of on and off, I guess?
Yes.
Or how did you?
Indeed. So I think, so it wasn't easy, I have to say. So as a chief executive, you obviously have to compartmentalise to a degree, and you know, I can do that, and holidays have always been important to me to be able to manage the roles that I do. But this was different because this was every day and it was in your home. It wasn't something you left at work. It was at home with you every day, relentlessly. So I think what worked for me and did make a difference, obviously family. You know, I've got, you know, a very supportive family. That does help, and they were very supportive of whatever I needed to do, I needed to do it. So they never questioned the fact that I wasn't there, or that I needed to be going and taking a call or going to do a meeting. And I was very absent, I think, is what I would say. They were very supportive of that, and I couldn't have done it without that. But also, if I had moments of time, watched rubbish TV. And actually, that works for me, you know, and it really is often rubbish, but it just stops me thinking, and I needed that mental stop.
Just to go back to what you were talking about in terms of the online aspect of things, it was nice to hear you refer to it as digital acceleration, because to me it was making it up as we went along, but it's nice to have a nice phrase for it, digital acceleration. We'll remember that.
Right.
You must, I guess, distilling it down in terms of how you operated during that period, and we've talked a bit about all those different aspects of how you operated. Distilling it down, you must have had some guiding principles internally, well, I guess internally as an individual, but also as a senior team and so on. You must have worked some guiding principles throughout that time.
Yes, I think it's really important, and these are ones that, you know, to some degree were there, but will go forward as well. But I think being able to empower other people is a significant one. And as I said, you know, we believe everyone's a leader in the organisations, and never a true word was said in this experience that we've had. You know, we needed to be able to empower people to take decisions at local level and to act and to do the right thing. And you know, there's a real lesson in leadership, I think, in that, you know, that if you can give people the information and you trust them to do what they need to do, they'll do a good job. And I think that's a really key guiding principle that we had. But you've also got to recognise that we won't always get it right. And I think that I certainly reflected on that, and I knew, you know, my direct team and the teams beyond me worried about that, you know, because you worried about getting things wrong. And my answer to that was, we will get things wrong. But you did it with the right intentions and with the information that you had at the time. So let's just accept that and learn. So I think that's really important. And then, as I say, this compassion for everybody. And I had people in the organisation reach out to me to say, are you okay? You know, and that might have been, and just to give an example, I mean, in LPT, one of the guys, I'm sure he won't mind saying, from finance, you know, would connect and just, you know, email and just say, look, you know, are you okay? What are you doing to support your well-being? Those things made a difference.
And had anything prior to this prepared you for this kind of thing? Anything in your career? You mentioned being in the NHS for 30 odd years.
Yes.
Were there things anything that had prepared you for this kind of thing?
To a degree, but nothing can prepare you for this, I think, is what I would say. But to a degree, yes, because I'd been involved in emergency planning. So, and of course, 34 years of experience, you bring it all to the table, don't you? And I knew that you only get through these moments if you use good people and empower them. So I knew that. But yes, I'd had some experience in, you know, a fire in the health service where we'd had to decant services over a long period of time, and an asbestos incident actually over a long time, but nothing like this. I mean, it just pales into insignificance. And as I say, I don't think anything can prepare you for it. And talking to other CEOs, peer colleagues, that it didn't matter what experience you had, this was new.
Yeah.
So you just had to make sure that you recognise that, draw on the skills that you had, but also use people and trust people to work well with you, which they did.
And when did you must have questioned yourself. When did you question yourself most as a leader, I guess?
Yeah, I think, particularly in those tired moments, inevitably you do get tired, and as much as you try to protect that, those moments, yes, certainly would, just question, have I got that right? Is there something? Or just question whether, you've took a decision, you've done it the best of intentions. Like I would say to staff, we'll get it wrong. Sometimes I would think, well, did you get that right? Go over things. But again, just making sure that you got the support around you when you did have those moments. And, what I would say is that I was supported, but inevitably have them. I don't think any leader, if they don't have them, I don't think they're being honest.
Yeah. Okay, we've whizzed through that half an hour.
Gosh.
And it was, I guess it was particularly nice, Angela, to, when we're talking about guiding principles, to hear that actually really the top of the list there was trust, wasn't it? So, really nice to hear. So we've whizzed through the half an hour. There's an opportunity for any of you guys to ask questions of Angela, should you wish. If you do want to do that, if we could wait for Holly to bring the microphone, mainly for the people who are watching and listening online so they can hear us, we can hear in the room. But any thoughts or anything reflections, things that we've heard from Angela that you'd like to ask her to talk a little bit more about, or ask different things around? Katie?
Thanks, Angela. That was a really great insight into that. I'm just wondering, because obviously you were chief exec of 2 trusts at that point, Northampton and Leicestershire, and one of them, Leicester City, was in lockdown and Northampton wasn't. Was there a sort of big difference for you in terms of seeing how staff were affected in those particular places, and indeed kind of the effects of the community of some of those aspects?
Yes, I think that was really hard, having the lockdown in Leicester in particular for so long as well, actually. And I mean, one of the first places nationally to go into that period. So yes, most certainly. I think it was harder for staff because it meant that we needed to be more severe in terms of whether we can go into areas. We had to be much more if you like, disciplined about who was working from home, etc. So definitely there was an effect. And I think in the communities, clearly a difference, because I think, many of our communities in Leicester, Leicestershire and Rutland were exasperated, I think, in terms of their connections with family and, for our own staff as well. They were part of that community. So again, the stories for staff and the connectivity for them, and the long time that it went over was significant, I think. But both were affected. It was just the degree, I think, that I saw the difference in. And, I know for myself, from a personal point of view, when you couldn't see your family, that's when your well-being does dip, isn't it? And you can't quite have those connections that you need. And it's the same in staff teams, isn't it? People need to connect. We can do lots of things virtually. I'm the first to say it. But actually you need to connect. And I think that was something that we definitely featured in both, but more in the lockdown.
Could you actually come into Leicestershire?
Not at one point, no, and that was really difficult.
Because that was, again, remembering back that having an LE postcode was the mark of Cain, wasn't it? And
it was. So it was like, and it was pre-vaccinations, and it was like essential travel. You couldn't come in, and you couldn't justify coming in, and actually you couldn't justify the fact that you could expose risk to anybody. So very strange time. I can't imagine it now. I mean, you forget even in a way that happened. But yeah, a very, very odd experience. But of course we all adapted. And as I said, without the virtual means, incredible acceleration that we did on that. I can't quite believe actually the way we could connect. And it had lots of benefits because more people could connect that perhaps wouldn't have met together. So like when we did our big conversations, you could get more staff in talking than ever before. So, immediately you could see some advantages in that as well. But very strange, very strange.
Kashika.
Thanks, Angela. It was really interesting hearing the insights of your position in LPT. Just one comment before I ask my question. It's really interesting talking to you about an 18-year-old with no mobile phone up at Scraps of Campus to digital acceleration and how the world has changed.
Yes, indeed.
But you talked quite a lot about well-being, the stresses and pressures, and as a leader, you would have had that physical as well as mental intensity over such a long period of time, as many people did in different levels of leadership. But would you say that that one thing, if there was anything positive that came out of that period, was people's consciousness about their own well-being, their own mental wellness, and how much more people are open about talking about it? Because prior to that, you didn't often talk about how you were coping. Do you think that's, at least if something's come out of it, it's that?
I do, and I think that's something we've seen in the organisations, in both of them actually, and I'll actively talk about it, and I think it's definitely a feature that people increasingly feel okay to do that. And sharing stories, I think, is a really powerful way of doing it, because you emotionally connect then, and people actually say, well, I can identify a bit with that and support people. So most certainly that's been much of a change. And the fact that we talk about self-compassion is very important, because all of us, and it doesn't matter what experience you've got, it doesn't matter what your role is, we all need to make sure we've got self-compassion. So the way you do it can be different, and that's what we talk about in both organisations, is that, for me, I like to do mindfulness. So it's just a 15-minute exercise, and I was very sceptical about it, but I'm now converted to it, and it helps me. Other people, it might be the yoga, and we brought in laughter therapy. We brought in so many things, and as a system, as well as doing what we were doing internally, and our chair, Kathy's a Wellbeing Guardian, and she's very active in terms of putting a message out every Wednesday about wellbeing and lots of activities. But in addition to that, as a system, we did wellbeing events and came together, and I think that was really powerful, because it was again virtual, but the fact that we're in this together and we can do different things, and you can have a flavour of perhaps trying something different that might help your wellbeing. So yes, I think, but people do talk more, and that's really good. So anything you can do to encourage people to do that, please do it.
And you managed to keep those things going then?
Yes. Yeah. So we've got a lot of those, and that's, in terms of us living with COVID, we have a very clear, structured programme for the next phase. So we have taken, obviously, the experience that we've had, but also the big conversations with staff. We have a programme of work around what's this next phase, and including that is new ways of working and things, but also the wellbeing and support for staff, so that we make sure that we can keep those constant and never really sort of not renew and think about what we can do differently.
Mel.
Thanks, Angela. Thank you for being so generous with your time and with your experiences this evening. I think there's been some fantastic insight there. I was interested a bit more about, I suppose, the position now as we come out of a pandemic, because I think one of the things that's interesting is everybody is coming out in their own way and moving at their own pace, and almost every single person is in a different psychological and physical position on this, and some people still highly anxious, some people just want to forget about it and move on, and with a complex organisation like yours, kind of finding a common ground and moving people together must be really challenging in that. So how you can kind of have that sense of collective direction, really.
Yes, no, it's a really, really good point. And I think that, as you say, in society generally, we're all at different points, and why wouldn't we be, to be honest? But yes, I think it comes back to how we deal with that is through this transformation programme, so that we don't do it in a sort of random way. We recognise that, the new ways of working is a feature, the wellbeing, etc., the fact that we've got to make sure we can look at recovering services, etc. So we have a very structured approach, but within that is the ability to adopt and adapt around different services and people, because you've got to adapt to a service needs and what's possible, but also then within that the individual's needs, etc. So we try to create a structure, but with room for flexibility, and that's what engaging with our staff gives us the sort of sense of how flexible do we need to be here. Let's understand what this means. We don't always get it right, I have to say, but the intentions are there. But I think it's really important to recognise that you've got to think about the individual, the team, the organisation, and then the population, and each is just as important. And that's how I tend to segment it in my mind. And of course we're reliant on local leaders to respond to their team, and that's why that connectivity is so critical. So just to give an example, so in my team, the executive team, we've said, well, one of the things we'll do is, adapting to new ways of working, is we'll have an anchor day. So we might be working differently now, but we'll connect together once a week where we all know we're in one place. That helps us as a team, but other teams will do different things. And I think it's encouraging the scope to say, actually, what works for one team will be different, but let's make sure individuals can connect if they need to, that sort of thing. And we'll learn, and we'll keep learning, I think.
Thank you.
Ali, we just...
Thank you. I've got a couple of questions, if I can be greedy. And I'm also a fellow scrap-tofter, so it's great to meet another scrap-tofter. We're just coming up to graduation, or hopefully it's assessments, and we've got people graduating. What advice could you offer to people coming up to that stage when they're moving into the NHS to work?
Yeah, well, it's a great place to work, that's what I would say. I mean, honestly, I couldn't enthuse more about the NHS, and having just described a very difficult period, and I wouldn't want to, say that hasn't been difficult, it's really been difficult. I wouldn't have wanted to have missed or not been part of it as well and played a role in it. So it's a great place to be, the NHS. It's got such a variety that it can offer you. It doesn't matter whether you go into a professional route or whether you go into different routes. It's people focused, and it's people that want to make a difference. And I think that if that's what you're about and you're committed, then we want you, actually. And so I think, as I say, I've done 34 years, but whether you're coming in new, the opportunities it gives you, the training and the career paths. People taking very different career paths. I mean, I didn't ever expect to be a chief exec. That was never a career path for me. I was always going to be a speech and language therapist. So, come in to the NHS is what I would say. We want you.
Great, thank you. And my other question, if I can ask it, is really one to say thank you for staff for all of the placements that they've provided throughout the pandemic, which has really been amazing for us as a programme, and I know the other healthcare programmes as well. But also because it's so essential to keep the workforce moving forward. So I just wondered, I don't know how easy it is to answer this, but what can we do to kind of help support your staff in creating and supporting those placements moving forward, so we keep that rolling, because we just know how challenging it has been to keep a placement just from a physical social distancing point of view.
Yes. Well, firstly, thank you for saying that it's been a positive experience, because again, on behalf of all the staff who've done that, I think they'll really appreciate that. But I think it's about that open dialogue and saying how's it working, not being too prescriptive, being open, active listening to say actually what would work. We were talking before we started about simulation, and it's an example of us all adapting to things, and I think we've all got to be open to, well, how does this work, and if it's not working for you, well, what could we do differently? And I think it's the same with placements. For the most part, people want to offer that. So if there's any resistance, it's not because people don't want to, it's because actually there's a challenge there that we need to talk about. So I think that active listening and trying new things is good. Again, I think what we've learned through the pandemic is that we don't always open our minds to different ways of doing things, and I think that's something I would take away from it most certainly. I didn't think we'd be in the digital space that we are, and I certainly didn't think we'd be working in the ways that we are, and I questioned myself, well, why did we not think that was possible? And I think it's the same.
Thank you. Thanks.
And we said earlier, didn't we, those incoming students who will be coming and doing placements at LPT, that digital change, they will
Yes.
have known nothing else in some
Exactly.
cases, and that'll
Exactly.
be absolutely normal to them now, and we have to accommodate that.
They expect
don't
it.
we? Yeah.
Expect it, and that's what I think it's given us, is that sort of sense of let's not be, if you like, too cautious. Let's be open to new ideas. Let's recognise there's new ways, and we may not know them yet, but if we talk and think about it, we may come up with new solutions and try things. That's the other thing. Try them.
Any final questions for Angela before we wrap up?
You hear it in every industry. When you put a new idea forward, somebody says, "Oh, but we've always done it like that."
Indeed.
But it isn't that I wanted to ask about. It's the fact that I remember hearing early on in the 2-year stretch that there had been a dummy run in 2016. Do you know anything about that? Because I heard there'd been a dummy run, emergency services had been used, it hadn't been terribly successful, but nobody had really questioned it or refined it or anything else? No?
No, certainly nothing in terms of that I would be aware of or involved in. People will do planning for emergency events, and particularly London region, for example, will plan, like obviously the Manchester bombing caused, all areas, I think, to think about how do you plan in emergency terms, but no, nothing that that suggests that for this that I was aware of or involved in.
Was the lockdown in Leicester largely due to a couple of health issues that are unique to Leicester? First of all, the high incidence of diabetes amongst the ethnic minority, and secondly, the geographical situation of lung and asthma, this type of thing, because they were certainly the ones that had the biggest problems in terms of illness. Going forward, are you able not to highlight those and maybe get some more funds to try and educate or pressurise, or whatever you like to call it, so that we have fewer of these regional problems? Because I certainly remember my cousin in Wiltshire, they had nothing like the numbers of COVID cases, nor of course did they have the lockdowns that we had here.
It's very difficult to be certain around the demographic effects around COVID. I mean, Ivan, I'm sure, would have spoken to some degree about it, but in essence, the lockdown was around the number of cases and the transmission rates that we had. Now, there's a lot of factors that influence that, which, obviously were a feature in Leicestershire, but it won't just have been diabetes, it'll be a combination of things. And I think that, again, what we saw later on through the pandemic was that there were other areas as high as Leicestershire, but we were one of the first. And so the lockdown affected us more significantly and for longer periods. But in essence, over time, others caught that up and, again, had very different demographics. So it was very difficult to be conclusive. I think the public health colleagues would be the best experts, if you like, in terms of what caused that initial position. But having said that, obviously the respiratory factors were significant, and of course that
You
is
can't do much about the geography of the
No.
fact we live in a dip. You can't do much about that.
No,
I realise
but obviously with the respiratory, we know that COVID did affect that, and so the important thing, I think, for any population is to make sure that all the preventative measures are being taken up, that the good support in primary care, that people are accessing the services that they need, to make sure that whatever circumstances they've got, they're optimising that. Because, and of course, vaccination, when you have those sorts of conditions, made a significant difference to whether you were likely to be hospitalised and seriously ill and or not. So it's encouraging those at-risk populations to make sure that vaccinations were taken up as well.
Well, the very fact that the vaccine was turned around in less than 6 months, wasn't it? There's never been such a fast result on a medical study. One hopes that kind of thing, regardless of what the problem is, that acceleration will continue within the medical,
Of course.
you know, and
course.
the research and development
Yes.
and what have you.
Definitely.
Because that certainly made
Yes.
an unbelievable difference.
It did, and I think, as I say, I'm so grateful and thankful for the vaccination, because that, whilst it's not a guarantee, it's literally gave us so much hope, and we saw the difference in terms of the effects for hospitalisations, because whilst people may have been in hospital with COVID, it wasn't necessarily the primary reason for them being in hospital, whereas obviously in the first waves it was. And the effects that we saw on staff in terms of getting vaccination was so significant. But I think it comes back to the research, and you mentioned research originally, Simon. And I think we're involved in research with COVID, and that's the good thing coming out of it, is that we need to encourage people to participate in research, don't we? And to make sure that we take the learning that we can as soon as we can, actually.
Yeah, absolutely. And I think it's going to be a while, isn't it, until those data come through, the epidemiological data.
Yeah.
It's going to be a while, I think, until we've got a true picture of the epidemiology. And furthermore, I guess, around the vaccines and how effective they've been. So it's going to be really interesting, I guess, as a in this university and beyond, as a researcher in health, as researchers in health, how we see those data come through over the next couple of years around epidemiology and around the therapeutics, the therapeutic aspect, I guess.
Yes, I think continual learning, to be honest, and that's been happening all the way through. But as you say, it's going to be, constant, really.
Okay, Angela, thanks very much. It's great. Thanks for agreeing to do this, because it is looking at your hopes and fears throughout a particular time, and that's that brings some really challenging things to discuss. So thanks for that. It's been really insightful, and I hope it's left us with plenty of food for thought. So
thank you. And thanks for listening.
many thanks to you, and thanks to the audience watching online, and hopefully the audience here will join us in the lobby for some drinks. So thanks again. So can we thank Angela?
Thank you. Thank you.
Thank you.